Hi, today we're going to talk about types of insulins. And so we're going to talk about onset, peak and duration, and some common orders that we utilize for medical management diabetes. So let's talk about short and fast acting insulins. Their onset is approximately 15 to 20 up to 30 minutes, sometimes a little longer. An onset means it's available in the vascular system. So what does that actually mean? It means that there's insulin available in the vascular system to be able to transport the glucose from the blood into the cells so the cells can utilize glucose and to function, lowering the glucose in the vascular supply, returning the glucose to a normal range. So let's talk about quickly the sliding scale. A sliding scale is often utilized when we're correcting a blood glucose. We're not sure what someone's baseline insulin needs are, or they have insulin resistance, and we're providing a correction or a supplement of insulin. So the sliding scale is often used, Novolog, Lispro, Apidra. Those are fast-acting insulins. And we use a scale to determine the amount of insulin. So if a blood sugar is around 250, they might get 4 units. That is providing that person a supplement of insulin. So they have extra insulin in the vascular supply to be able to utilize that glucose and lower the glucose in the vascular supply back to the normal range. We might do a scheduled amount of insulin. Scheduled amount of insulin is for the food a person's about to take in. And so we may do, it's a general guideline is around 1 unit for every 10 grams of carbohydrates the person will eat. We might do 1 for every 20 if we don't want to be so tight control. Sometimes it might be a different insulin to carb ratio if a person has an endocrinologist and they've been following them. But in general, it might be 1 to 10 or 1 to 20. So you might see 4 units, and 6 units. And so we're assuming that that person's going to eat at least 45 up to 60 grams of carbohydrates a day. And that is a general guideline for intake. So we want to ensure they at least take in at least 45 grams of healthy carbohydrates, up to 60 for a meal. In general guidelines, it's approximately 150 to 180 grams of carbohydrates divided into meals and snacks is the recommendation. And of course, it depends on the activity and the weight needs for somebody for determine their exact carbohydrate intake needs when we're looking at that. So we're trying to have a combination of insulins, something that we're hoping to mimic what the pancreas should be doing if it was making a normal amount of insulin. And then again, the sliding scale works really well for the correction. But again, we're correcting what the blood sugar is, so that means it's out of target ranges. We are aware that blood glucose greater than 152 puts a person at risk for surgical site infection, poor wound healing, and also once the blood sugar hits around 170, the kidneys will start to diurese, so we might lose sodium and potassium, so we could have electrolyte abnormalities also. So it's important to keep the blood glucose between those target ranges without allowing it to go too high or having hypoglycemia and out of range when we're doing a correction. So when we talk about some other insulins, there's an NPH, which is an intermediate. It has a onset around 1 to 3 hours. It has a duration, it peaks about 8, but it has a duration of about 12 to 16 hours. NPH is often used primary cares because they want to reduce the number of injections required for that person. So they are able to put them on 2 doses to cover them for 12 hours. Unfortunately, it's unpredictable because it can have that peak and we're taking it 2 different times. It's going to have 2 different peaks in duration. So if a person's not eating during that peak area, then they may have hypoglycemia. NPH is commonly used for gestational hyperglycemia. Again, so that the person can only have to take 2 doses per day. NPH is recommended for gestational, is one of the insulins, and that's why it's often recommended. It's utilized, it says off-label NPH for the practice of gestational diabetes. Of course, someone who has been on a long-acting or other insulin combinations prior to pregnancy and during pregnancy, they'll often stay on those insulins that they've already been on during the previous part of being period before pregnancy, since if they've had good target ranges. Then we have long-acting insulins. And long-acting insulins, we have our Lantus, our Levemir, our Semglee, Basaglar, and those insulins actually work approximately, they have a slight peak, but they will work for 24 hours, some up to 46 hours. And so that is just a basal amount of insulin, so that person just has some background insulin throughout the day when the cells need glucose. So it works very, very well. And many of those patients make some small amount of insulin, so they are making a fast-acting or a mealtime insulin. Their pancreas is making some insulin. And so how would we know that? Well, if they eat the right amount of carbohydrates in 2 hours post-meal, the blood sugar is down to a normal range, and then they don't have low blood sugars, and most of their blood sugars are in target ranges, then they are making some of the long actings covering it. If they remain high during a mealtime or post-meal, they probably aren't making a faster acting insulin, and sometimes they will need a supplement or a scheduled amount of insulin with the meals. Again, the whole point is trying to keep the blood glucose above 80 and less than 180 without having too many highs and too many lows to keep the vascular system healthy. Unused glucose binds to the red blood cells, and so what happens is that glycemic coating will prevent that soft red blood cell from being able to pick up oxygen. Those red blood cells can stick together and break those microvessels in the eyes, the kidneys, and organs. So again, the goal is to keep the vascular system healthy, to keep our red blood cells nice and safe and healthy, so they're able to transport oxygen into our tissue and organs to heal and to function properly. So diabetes is a vascular disease. Yes, it's a glucose vascular disease that can cause blindness, risk of heart attack and stroke, poor wound healing, and many other complications. So I hope that was helpful. If you have any questions, please feel free to contact me.